In this video, I'm going to show you how to fix knee snapping and pop sounds using no special equipment. Stay tuned. Hey everyone, Dr. Rowe from SpineCare in St. Joseph, Michigan. So in this video, we're going to focus on a very easy three-part process that is going to help get rid of clicking, popping, grinding sounds in the knee. In the first part, we're going to focus on just getting all of the soft tissue loosened up around the knee, get rid of that tendon snapping, which is a major cause. Second, we're going to focus on getting everything moving with a lot of good, safe, effective stretches. All of these movements are great for people that have wear and tear in the knee, especially degenerative arthritis. Third, we're going to focus on strengthening everything in the knee to make it where you hopefully will have a lot less issues in the future. As a note before we get started, this is only for simple strains and sprains of the knee. This will not help something major like a ligament tear or a meniscal tear. If you suspect that you have that, please consult with your local doctor instead. With that being said, let's get started and get rid of those snapping and popping sounds in the knee right now. This video is going to be broken up into three separate parts. Each of them are very important, so go through all three to get the best results. The first part, we're going to focus on loosening up soft tissue, including tight muscle tendons that might be snapping with movements. And we're going to help that through a technique called muscle scraping or gua sha. So this method is very easy and effective towards breaking up a lot of adhesions around the knee that might cause that snapping. I'm going to be using a couple things. The first being a butter knife. You can also use a spoon. If you are using a butter knife, just make sure to take a small towel and wrap over the serrated part right here so you're not over any sharp parts. The next thing I'm going to be using is some coconut oil. You just need a basic form of lubrication. You can also use icy hot or biofreeze. But what I'm going to do is start off by taking our lubrication right here and just putting it all over the area of the knee, to the sides, to the front, top, bottom, everything. And when it comes to lubrication, a little bit more is always better. So once we have that, let's take our tool right here, and then I'm going to start off on the quadricep up here. Let's just put pressure into that muscle very slightly, and I'm just going to go down with it towards the knee. Just nice, even movements. And when you go over this, you're going to notice that certain spots feel just a little bit more gritty. In this case, it's right here for me. And when I do this, I don't know if you're going to see it too well on the video, you're going to notice that pockets of redness start to form. That's blood coming to the surface. What it does is it promotes healing. But you want to do this right here slowly for about 10 times, and then from there, go backwards with it. Attack it at a different angle. And then once you're done with that for 10 times, go at just like a 45-degree angle. But experiment with it and really try to work on those gritty spots and try to break up those adhesions. When you do this too, try to keep off any bony spots. You only want to do the soft tissue. So you can take the edge right here and go off to the side of the kneecap. Just really dig in there and experiment and really find the spots that need just a little bit more attention. But you're going to want to repeat this on the inside of the leg, top part of the shin right here, the calf, underneath the leg on the hamstring, off to the side. And once you're done with that, what you're going to want to do is just take the knee up and down and still see if there is some clicking going on. If there is, try to pinpoint that area, and then while you're doing this movement, repeat that method and just really target on different angles and different spots until you feel like it's really starting to loosen up and you're getting a lot less clicking sounds in there. But again, go all the way around the knee, go lightly with it, and stay off any bony parts. So one of the biggest causes of knee clicks and popping sounds is lack of mobility. Everything is tight and locked up. So here's a great way that we can focus on improving range of motion into the knee. This is called a knee rock back. You can do this one in bed or on the floor. If you choose to do it on the floor, just make sure to put a towel or pillow underneath your knees for extra comfort. Let's start off on all fours just like this. What I'm going to do is a very simple motion, and I'm going to show a beginner's and then the one that's a little bit more advanced. With the beginners, I want to sandwich a pillow underneath, I should say, between my hamstrings and my calves. And the movement is very simple. With my back straight, no pelvic tilt, I'm going to rock my body backwards, but towards the heels. Go down as far as you feel comfortable. Once you feel like you have a very good stretch into the legs and into the knees, hold this position for about 3 seconds. You're just going to come back up and then slowly repeat this. If this becomes too easy, what you do is you just take the pillow out right here and then just repeat, going down even deeper with it. Why I like this one is because it really focuses on the big muscle groups around the knees, the quadriceps, hamstrings. And with this one, you can also concentrate on certain knee flexion movements that give those popping sounds. Let's say that I'm able to go down about right here, and that's when I start to feel like a clicking sensation into the knee. Make note of that. So what you want to do is just go up a little bit and then go back down. And keep repeating this over and over again until you finally feel that start to release and that popping sensation goes away. But you want to do this nice, slow, controlled movements for about 10 to 12 times. And from there, just relax and then repeat up to 3 times as needed. So this next knee mobility exercise is great because it's going to focus on putting it through a lot of different ranges of motion so we can pinpoint movements that are doing those popping and clicking sounds. It's known as a knee glider. What I'm going to be using for this one is a furniture mover. If you do not have a furniture mover, you can use a piece of cardboard or a paper plate if you are on carpeted floors. If you have hard floors, just put a towel underneath your foot. So what I'm going to do is put that piece of cardboard or that paper plate underneath the foot right here. We're going to go into a squatting position. So let's just squat down like this. Let's make sure that our lower back has very good posture while we do this. Our arms can go on the side of the hips or they can just go out in front of you just like this. The movement is very simple. What I'm going to do is keep one leg bent. That is the knee that does not have a piece of equipment underneath it, while this leg goes out starting at a 45-degree angle. Just go out very, very slowly with it. Nice fluid motions as far as you're able to go. Hold this for about a second once you hit that point and then just come back. When we do this, we want to keep this knee straight in front of us. We do not want it to buckle inwards. But I'm going to do this for about 3 to 5 repetitions. From there, I'm going to go just a little bit more towards my side, so bringing that foot towards me just a little bit. When you do this, you're going to notice that it hits the muscles a little bit differently. That's the great part about this. We're going to focus on so many different muscle groups, the abductors and adductors of the leg, even the groin muscles. So let's go out towards the side at this point. And then when you do this, you want to keep going as far back as you can comfortably, so a nice arc. You're going to notice that one certain angle, one certain movement really feels weak. Maybe it's starting to give clicking and popping sounds into the knee at that point. Make note of that. Focus on doing more repetitions just to release that soft tissue and hopefully get rid of that clicking, popping, or knee sounds. So when I do this, I go into a complete arc, and then from there, I'm just going to go to the other side and repeat. You want to keep both sides in balance. So here is a great self-traction you can do to build a lot of motion into the knee. This is really good for arthritic conditions, especially crepitus sounds, that bone-on-bone grinding. Let's go to the edge of a bed. Take a small towel, roll it up, and place it behind the knee just like this. The movement is very simple. We're going to use our body weight right here and just lower the butt down towards the floor. When we do this, you're really going to feel a great stretch in between the knee. It's helping to traction it open. Only go to your comfort level. Once you hit that point, hold this for 10 to 15 seconds, come back up, take a breather, and then repeat this up to 5 times. Each time you do this, try to go a little bit further with it to help open up and traction that knee a little bit more. And hopefully this will get rid of a lot more of those popping sounds. If you do feel the knee release kind of like a knuckle crack pop, that is very common. It's just gases being released very quickly. But once you're done on one side, switch to the other side to keep both in balance. So if we're looking at getting rid of knee snapping and popping sounds, we have to focus on strengthening it. Here is a popular exercise that we can modify to really focus on motions that feel weak or maybe are offering those popping sounds so we can really target them. I'm going to go next to a wall or a door. What I'm going to do is place my feet just a little bit in front of me right here while my upper body is completely flush against this door or the wall, including the back of my head. My toes are going to go out slightly, about 10 degrees. This will help take strain off the knees while we do this. From there, what I'm going to do is put my arms out in front of me, and I'm just going to slide my body down towards the floor. You're going to go into what is known as a wall squat. Go down as far as you feel comfortable. The goal is to get it to about a 90-degree angle at the knees, so the back of the legs are parallel with the floor. Go down as far as you feel comfortable. Hold this for about 5 seconds. You're just going to come back up, take a breather, and then repeat this up to 10 times. How we can modify this to target those spots that offer clicking. Maybe there's a certain angle that you get to, then it all of a sudden starts to feel weak, or you start to feel that popping sensation into the knee. Let's say it's right here for me. What I'm going to do is I'm going to go a little bit further down, and then I'm going to come back up. And then I'm just going to go back down a little bit more, build into it, try to go a little bit further with it, and then come back up. What I'm trying to do is throw extra repetitions into that certain spot and work on it to help not only lengthen the muscles and the soft tissue, including those tendons that might be snapping, but it's just going to focus on strengthening that whole movement also. But throw a little bit more repetitions in, go over different angles that you feel have a lot of weakness, and hopefully it will help lead to a lot less popping sounds. Here's another great knee strengthening exercise that is going to target weak spots, but also spots that are causing snapping and popping sounds. What I'm going to be using is a yoga block. You can also use a hardcover book, or you can go to the bottom of a staircase. What I want to do is place the knee that we're focusing on up on that yoga block or the staircase, and if you need extra support while doing this, you can have a chair off to the side. This is a 3-part exercise. The first part, what I'm going to do is I'm going to make sure that I have good upright posture. I'm going to take the leg that is off that block, point the toes up towards the ceiling, and then just simply lower my knee down until I just touch the heel to the floor. Just nice, slow, controlled movements. And when you do this, you're really going to feel the muscles around that knee start to fire. So do nice, slow, controlled movements for about 10 repetitions. For the second part, we're going to go all the way back with it. And this one's a little bit more difficult. So I'm going to bend the knee and just touch the toe. And then I'm going to, again, repeat this for 10 times with nice, slow, controlled movements. Take a breather and then throw another set. If all of this is too easy, what we can do from there is then do an alternating heel to a toe touch with it. But go through all of these motions. If you feel that one is just a little bit more weak, or you're starting to have popping sounds while doing it, throw more repetitions in there to address that. But once you're done on one side, always make sure to then go towards the other to keep them both in balance. If you liked the video and got a lot of relief, please show us your support by giving this video a like and maybe subscribing to our channel too. If you have any comments or questions, please leave them below. I'll get back to you as soon as I can. Thank you for watching.